Millions of people in the UK are missing out on up to £440 every single month, money they could legally claim from the government for one of the most common health conditions in the country. If you or someone you know is living with this, you might be entitled to thousands of pounds a year, and you probably don't even know it. Right now, across the UK, millions of people are living with a health condition that makes daily life harder. But here's the shocking part. Many of them could be claiming up to £440 every month from the Department for Work and Pensions and don't even know it. This is money designed to help with the extra costs of living with this condition, yet billions remain unclaimed every year. Today, we're breaking down who can get it, why so many miss out, and how you could be entitled. Across the UK, millions of people are living with health conditions that make daily life more difficult. For some, these challenges are obvious, but for many others, they're invisible, often dismissed, and rarely given the attention they deserve. What most people don't realize is that the UK government, through the Department for Work and Pensions, is offering financial help that could make a huge difference. In fact, if you're living with a certain common condition, you could be entitled to as much as £440 every month, yet millions aren't claiming it. This money is available through Personal Independence Payment, or PIP. It's designed to help people with the extra costs of living with a long-term illness, disability, or mental health condition. The surprising thing is that a condition affecting millions across the UK qualifies for this benefit, but many simply don't know they can apply. That condition is arthritis. More than 10 million people in the UK live with some form of it, including osteoarthritis and rheumatoid arthritis, and it's one of the leading causes of disability. Arthritis can make even simple tasks, like walking to the shop or making a cup of tea, painful and exhausting. Some days might be manageable, but on others, the pain and stiffness can be overwhelming. Despite this, countless people never apply for PIP because they assume they won't qualify, especially if they still work or have good days. But here's the key point. PIP is not means-tested, and it's not about whether you have a job. It's about how your condition affects your daily life. If arthritis impacts your ability to cook, clean, travel, or carry out other everyday activities, you might be eligible. The payment can reach over £440 a month, adding up to more than $5,000 a year, money that could help cover heating bills, mobility aids, transport costs, or even just the rising cost of living. So why aren't people claiming? For many, it's the complexity of the application process. Applying for PIP involves filling in detailed forms, providing medical evidence, and often attending an assessment. It can feel overwhelming. But charities and advice services across the country are urging people not to give up. They stress that this money exists for a reason, to help people cope with the extra costs of living with a long-term condition. Importantly, the DWP recognizes that conditions like arthritis can fluctuate. You don't have to be in constant pain every hour of the day to qualify. If your symptoms regularly limit your independence, that's enough to be considered. Successful claimants often describe the payment as life-changing. Some use it to pay for home adaptations, ergonomic furniture, or taxis to hospital appointments. Others simply appreciate the financial breathing room it gives them, easing the stress that can worsen their condition. There's also a mobility component to PIP. If arthritis severely affects your ability to move around, you might qualify for the higher rate mobility payment, which could open the door to the mobility scheme, allowing you to lease a car, scooter, or powered wheelchair. For many, this is the difference between isolation and independence. Campaigners are calling for greater awareness so that fewer people miss out. They argue that the government should do more to actively inform those who might be eligible, rather than relying on them to find out on their own. In the meantime, charities and advice centers are stepping in to guide people through the process. The bottom line is simple. If you or someone you know is living with arthritis, it's worth checking if you qualify for PIP. Even if you think you might not be eligible, you could be surprised. The application might take time and effort, but the reward, up to £440 a month, can be life-changing. In the middle of a cost of living crisis, that kind of support is not something to ignore. This money has been set aside to help those who need it most. If you qualify, it's not a favor or a handout, it's your right. If you or someone you know is living with this condition, don't let thousands of pounds slip through your fingers. The money is there, the rules are clear, and if you qualify, it's your right to claim it. Take the time to check your eligibility and apply, because in the middle of a cost of living crisis, every penny counts. And remember, sharing this information could help someone you know gain the financial support they desperately need.